Hi, my name is Alexis Oliver. My ID number is 298-1022. Alright, so one very, very important useful thing that we need for radiographs is our dosimetry badge. This is our thyroid pad, and then we're going to place the dosimetry badge right over it. And this is going to help us manage the amount of scatter radiation we're retrieving through our system. So the dosimetry badge, how it works is there's a little plate inside of this, and this is going to measure not the direct radiation we're getting or the patient is getting, but the scatter that is emitting from the machine afterwards. And how we can check those, our manager has an account set up to where we get reports, and we get quarterly reports every 3 months, and that will tell us about our different our levels. There's level 1, level 2, and level 3 for radiation that you're allowed to have, and it also lets us shows all the staff and how much we're getting. It goes from deep to eye to shallow, and then our total annual. So let's take a look. So here we have a report at our clinic. So with 2 pages worth of staff. So if you look at this bottom page, this is going to be our threshold levels. So we have level 1, level 2, level 3. We like to stay in between level 1 and level 2, but it is awesome. It takes a lot to even get past level 1. So I'm going to look at mine. I've been here for 3 years. Let's see. So far my threshold is only 74. So that's awesome. So, and that has even met the annual threshold we have for DDAT all. So if we look at April, who has been here for 12 plus years, you find April all the way over, and she's at 349, and she still isn't even at the threshold. She's not even near it. So that is how we look at the dosimetry. We print this out every year, and we keep it in our radiology log. So how we're looking for damaged PPE, we take a look at our lead barriers. So we have our thyroid. What we're looking for is any tears or anything that could be emitting past the lead in here. So we expect them every time that we use them, just because cats and dogs can definitely be an issue. A main thing is you definitely never want to fold them, especially the aprons. So we have an apron here. Let me see if I can transfer this over. This is our apron. It is lead based, and we always look at it every time we are about to wear it, just to look for any tears or rips. You can definitely see there are scratches on it from definitely our patients. You see it's on this rack here. Is we never want to fold these guys, because that can do some major damage to it, and that's gonna put a default in the apron. Hi, my name is Alexis. I'm gonna go over the proper PPE for radiographs. On my neck I have our thyroid protection, and then on my body I have my dosimetry badge. That's going to show the proper amount of radiation I've been exposed to taking x-rays. I have my lead shield, and then another PPE that we always use is lead gloves, and we use the lead gloves when we're restraining to pull out the legs, front or bottom, and then we can also use it in case that we need to hold a certain way. We can also block our hands or whatever we're using to protect us from radiation. And other ways to help with different restraint techniques, we have muzzles. We have cat muzzles and dog muzzles. Cats can definitely be a little bit tricky, especially when you're trying to do a chest view of a cat on its back, because you're needing to extend the neck forward and the arms, and sometimes they can be a little bit challenging. So if you do not have a cat muzzle, which we do have, you can also use a towel. We place over the head to kind of make them relaxed, and then sometimes you always cannot restrain their scruff, because that's going to mess up the view of the shot. I apologize, but in one of the videos for the positioning, I did use a towel on a little cat, and then I also will place my hand safely underneath her jaw, and I will extend her head up with my other hand, and I place the towel first on her head so she doesn't see anything, and then I wear gloves on top of everything. So I'm safe, she's not going to bite me, she's more calm, and that definitely helped out. And then with dogs, depending on what we're shooting, you'll have 1 to 2 people. Muzzles help as well. How certain ways we would help if they're kind of a little nervous and we're doing especially abdominal works, but not necessarily on chest is you can use your forearm to kind of lay across their neck, kind of calm them down a little bit. You still want to protect yourself against from any of the beam. You do not want to be in part of the beam at all, but it's going to help in the long run because you're going to help make that dog stay still and kind of help them out. Alright, so there are a few protective barriers that can be utilized during when we're taking radiographs. We have the trough, which is the V-shaped kind of padding that we use for patients that are getting lying on their back for either hips, chest, or abdomen, or even skull. That can help, instead of a person holding them and keeping them straight, we have the trough that can help hold up the animal as well, so it's less exposure for the technician. We also use either slip leashes or gauze to help restrain the legs. So if they're asleep, we definitely use that, and if they're awake, we can use it to extend out the extremities, like the radius and ulna, or even the stifles and stuff like that, because the less we are exposed to, the better, because the radiation that we are using is ionizing radiation, which is a cell damaging type of radiation. But the amount that we need to be exposed to is definitely really high, which is why we have the dosimetry badges to keep track of that. But the less we are exposed to, the better, and that's why we use the PPE and definitely other instruments to help us. With that, we have several people that cannot participate in x-rays, like pregnant women or any person under 18, and the reason why is that they are still developing. And with this type of radiation and our bodies, we're 80% water. And with our DNA, the radiation will affect us and affect our DNA and our cells to even cause cancer and hurt our cells. And with a pregnant woman, they are carrying a child which is still developing. And if you're under 18, you are still developing as yourself, and it can hurt in growth, it can hurt in cells and stuff like that. And especially if you are not a trained person to be using radiographs, we want you out of the room, even out of kind of the area we are even doing radiographs, because of scatter radiation. Every client or every patient, every employee that works here has their own dosimetry badge for that reason. So anytime they're in the radiology suite, it goes on them, because even with the radio, if you're not taking radiographs and the machine's on, it's still emitting radiation. And we have several controls set up to see what's scattering and what is not, what is staying in here, which is definitely safety. And we want to make sure with the patient as well, we want to get the shot correct on the first try, is because we want to use less radiation as possible, because sometimes if they're moving, unfortunately, it can take up to 4 or 5 tries, and that is a lot of tries trying to get the patient still. And you never want to put a person through that, or the animal through that, because it is damaging and it can do some harm. And the other reason why we don't recommend like holding the animal unless it's an emergency, like during a let's see, a pen hip, we don't use a chop because that can affect the outcome of the thing. We have a person kind of holding the body, but that body is shielded, and the thing is that person is still not near the beam at all, because if you are under the beam, that is direct ionizing radiation, and that is definitely not good. So we take all the precautions and here very seriously. Alright, so one of the videos I will show you is how we will restrain for certain views. We typically restrain for when we're either sedated or for certain limb views. So when we have, let's see, you will see that I'm doing a cranial extension of the radius and ulna. You will see on the cat that we wrapped her carpus with gauze, so that indicates that we are going to be stretching out her legs, so we can get that full shot of the radius, ulna, and even her carpus. And the fact that neither of the technician's hands will be in that shot, or even gloves, is perfect, and we're able to fully extend and not hurt the cat, and she will take it better. And so we also have our troughs that we use. We have a small one and a large one. This is for our VD views, and certain other ones, like we do hips, chest, abdomen, all ventral, dorsal views. We unfortunately do not have any sandbags that we typically use. Unfortunately, we don't have any here. But we also, if we need to kind of hold a leg a certain way, we also use a wooden spoon, which unfortunately I can't find because we used it earlier. We can use a wooden spoon or anything kind of radio opaque that will not show up. And also we've used even styrofoam for when we do exotic radiographs. So how we do certain ones is, yes, you can get a regular DV using the radiograph, but when we're trying to do a lateral or a rostral view, we stack them on cans because we're able to flip our machine horizontal, so it's able to get the nice view with it. So we'll stack cans up, and of course those will definitely show up on radiographs, and if the turtle's right on it, it's going to be kind of confusing to differentiate to see if something's actually in the turtle or not. So we use those thick styrofoam to separate the fact that the cans are from the turtle, and we're able to see what's exactly in the turtle versus just looking at the cans. So those are some of our things we use to help with radiographs. Alright, for this next video, we're gonna, Hiccup and I are going to demonstrate how to measure and perform a lateral viewing of our tibia and fibula. So where you measure that at is, you're going to measure at the distal end of the femur. So we have his femur, we have his patella and stifle. As soon as we get that measurement, we're going to put that into our chart, and that will give us the perfect measurement for that. And then he's going to lay down. Come here. Come here, turn around. Turn around. Come on, continue. All right, sit. Down. All the way. Good boy. All right, so we're going to move the crosshairs over and extend it so we get the full places that we need. So his right leg, his right side is down again, and that's the leg I'm getting for is the right leg. So I'm going to place the right marker right next to his right leg. Simple as that. And typically they can be sedated for this, but they don't always have to be. Hiccup, in his case, he is very, very good. In some instances, you can use a slip leash or gauze to fully extend that leg back. But I'm perfectly comfortable doing it myself. Pick up. Stop. Give me it. Give me it. So I'm pulling that leg down. So the crosshairs is going to be right on top of the tibia and fibula. And I'm pulling the left leg out. So I'm not going to get that in the shot. And my gloves are covering just right before the hock. But it's perfectly fine picture right there. So we have the crosshairs going over, and he did great. Alright, so in this video I'll be demonstrating how to perform and get a cranial caudal version of the radius and ulna. So Emmeline is tying gauze, non-stretch gauze, to her feet, so we're better able to extend the legs out for a better view of both limbs. Alright, and where we measure is, you're going to measure at the distal end of the humerus. So after she is done attaching the gauze, we will measure real quick. And of course she wants love in the meantime. I like having two people for this position, one to hold the body and the head up, and the other person to extend out the legs with the gauze. So depending on what side she's facing, her head is toward the north. So we have our left and our right indicator. I'm going to place, typically when we're using, if it's an affected leg, I always like to put the indicator at that leg so we know that's the one we're absolutely looking at. But in this case, I'm going to be placing the left indicator on her outer part of her left leg instead of the middle, because sometimes that can definitely get confusing whether what is the true left. So I'm going to put it on the outside of her. So I'm going to measure her leg. You extend her leg up, just one of the legs up. Alright. Good girl. Alright, so I have her measurement, and we're going to go look over at the pre-measured sheet we have, and then we'll plug it into our x-ray machine, and then we're going to focus. We would move this x-ray over. It would have the crosshairs focused in on her radius and ulna only. So we're going to close this in. So how we typically do this, I'll have to remove the towel, unfortunately. Perfect. So keep the light on. Sometimes it's best to turn off the light, especially if they're a darker cat, because it's hard to see. Of course she wants booty love. All right, so I'm going to extend her neck upwards while Emmeline pulls her feet forward. So we want the legs flat as possible when it comes to this view. I know, baby girl. You're doing great. You're doing great. So her crosshairs are going right between her radius and ulna, and how you keep the neck extended up. You can definitely see that my hands can be in it, but we have gloves. We can get a glove. You're doing so good. I don't think she is. I know. And I would
You're doing so good, baby. I'm so proud.
use this glove above her head and to block the view of my hand getting in the way to emit any unnecessary radiation. So she did great for that demonstration. She wants that off. So we'll just do another view in a second. All right, in this video, Hank and I are going to demonstrate how to measure and show how to hold for hip x-rays. So typically they can be definitely either anesthetized or sedated, depending on what views you're looking for. We can do pin hip, and we can also do OFA, and we can also do hips as well if sometimes they just need x-rays right away. So you're going to measure the thickest part of the pelvis. Good boy. Since we're doing VD, we're doing this view. Come here, baby, move forward. All right, we'll get that plugged in. We'll get them into the trough because that is the only other thing we need. And we'll see you back just in a second. Okay. Okay. Good boy. All right, so we have Hiccup in the trough. He did perfectly fine. So I'm gonna go over here near his hips. Yes, someone can be at the front loving on him, but as of right now, he's doing really good. So we're gonna do the crosshairs over his pelvis. Exactly. You definitely want him super straight. That's why it's always nice to have someone at the other end. I know, baby, he just wants love. So I'm getting my gloves on. I always manage to put them on the wrong hand. Stay, baby. No, you're so happy. All right, how we do it is I'm not going to go full extend on him just because he is awake and has no pain meds on him, but we're going to extend his legs out. So we want that hip to be extended. And then what we do next, I know he's ready. We're going to invert his knees. All right, so for this video we have Hiccup, and he's going to help us demonstrate how to get an x-ray for a lateral abdomen. So he is naked right now. We took off his harness and he's loving life. He has 3 legs, and that doesn't stop him. So where you measure for abdomen is you're going to find the 13th rib, and it's going to be caudal to that. So for lateral, I'm going to measure on top. We have that 13th rib. We have our measurement. Then we're going to take a look at our chart that already has the pre-measurements on it, and we would plug it in here. And then Hiccup is going to lay down. Him I can typically do right by myself. He is amazing. All right, flip over. Good boy. Alrighty. So for Hiccup, he's amazing. And so how we would do this is, if I can put on the proper glove side, we would place, he is in right lateral right now, so his right side is on the table. So I would place the marker with the R on it right in the shot near his abdomen. We would have the crosshairs. I will open it and extend it because he is not the size of the kitty. And I will place these crosshairs right over the stomach, Actually, I'm gonna go down just a little bit. So go right in the middle. So right before the crosshair, so we can get the stomach, the diaphragm, and everything in there. So I have our marker down. It's kind of getting hard to see him. And then we're gonna extend. I'm gonna extend his back legs. I'm also going to extend his front legs as well. I know. Lay down. And that's the perfect shot for him. This will tell us if there's any possible obstruction, gas patterns, or anything, because he has a huge history of eating things, and he's had a couple exploratories in his life so far. But he did great for the abdomen. We'll move on to something else.
You're doing so good.
All right, so in this video, we'll be doing our VD, our ventral dorsal aspect of our chest. So where you measure, it's going to be the caudal end of the scapula. So since we're doing a VD, I'm going to go underneath her. Hi, sweetheart. Feel where her scapulas are. Go slightly under you. Alrighty. I have her measurement, and in a second we'll get her into the trough. Alright, so we have Miss Concord in her trough. She's a little nervous, so we're going to cover her face ever so slightly. She likes the dark. But in this shot, I'm going to have her, pull her arms toward her head. And I'm also going to pull back her head as well. And then we want the crosshairs of the view to be right in the middle of her chest. And we have our marker on her right side. So it's an indicator when we flip it onto the computer, we can tell which is right from left. And she's doing great. We want her straight as possible, so we have M1 on the end, fully stretching her legs. And I have my arms on top, and I have my hand underneath holding her head. And then again, I would use, you're doing so well, a glove, again to minimize anything I don't need. And then I would take the picture. She did great.
You did so good. Oh, look at that big old fat belly.
You're fine. All right, so this is our X-ray machine. I recently already turned it on. So we have our light right here. And that's going to show the crosshairs where everything should be. We have our two knobs right here that is able to extend the crosshairs either horizontally or vertically, depending on the size of the animal. And we always, when we plug in for our machine, we hit our manual, and that will get us set up with our KVP, our MAS, and our MA. Typically our MA always stays at 300 for our shots, and we can definitely change our KVP up, down, and our MAS up and down, always depending on what our measurements say. So we have our caliper, our measuring kind of device. So we always look at the centimeter side. We have an inch side and a centimeter side. How we always measure is on the centimeter side. So let's say if we measure an animal, you will see me measure 5 times and following videos to show how to properly measure for animals, because it's going to be up close. So let's say we're measuring and the animal comes up 9. Doesn't matter for what, we're going to use the number 9. So this measurement for our technique is already pre-made, and it's been done by people of IDEX, which is a laboratory system. So they have created this for us to help us out. So we have our skull, spine, pelvis, extremities, exotics, we have thorax, abdomen, and then we have our tabletop settings for when we have kind of very small animals. So we have our tabletop side and our Bucky side. So we measured at 9. And so if we were, so that's tabletop, so we would move our machine up. So we have film tree, we have tabletop, so we move it up. So let's say we're doing thorax on a tiny, tiny animal. So we would do our KVP be 87 and our MAS would be 20. So go over here, we said 87 and 2.0. I said 20, that is so my bad. So we have our settings properly for this animal. And so if we were doing a thicker animal, let's go up to 10. And if we're doing, again, thorax, we move up to 90 and 2.5. Move it up and move it up. And then again, you want to make sure you bring the film tray down, because that definitely affects your views of the radiograph machine. We also have our indicators, our left and right, which are hugely very, very important. But it's always nice to have this sheet that was made for us, especially for this machine. We just got a new machine, but it's very nice to have. So you want to make sure you are measuring in the correct spots for animals, because even the slightest number change can either show definitely not enough, or can be too much and it'll burn through. So that is our X-ray machine. We turn it off. Alright, in this video I'm going to discuss and show you how to insert a new patient into our system, and we're also going to collect x-rays on 2 patients that have already been taken on in our system. So one second. Alright, so in this video I'm going to demonstrate how to insert a new patient into our software system. We have a group called Cornerstone, and that's how everything is transferred into, even our radiographs. Even our radiograph machine is able to send the radiographs directly to this account. So we use a regular kind of new client account when we want to practice on some things. So to add a new client or a new patient into the system, we'll go to the patient list, right click and hit new. And this is where everything pops up. So I will tab down so we don't edit the number. So we can type in a dog's name. I'm going to use mine for reference. So her name is Sheila. She's a family pet. She is spayed. And her birthday was 11/29/2014. She is a canine. She is an Australian Shepherd. If it lets me do it. And she is a blue merle. Right there. And so you can add in other information like her microchip information. You go to prompts and notes. You can add attention or allergies, diet, which she all has. So how you would save it is we would hit OK, and then her name would pop up in this system under this client as well. Alright, so there's a few different ways where we can look up radiographs from a patient. We can either go to the patient's direct account like this. So I'm going to go type in, let's see, my dog's name that we just did, so Charlie Oliver Corgi. So his will pop up, and then you see these images. It'll say image abdomen, abdomen, abdomen. We did a barium study on him. You can either click that x-ray, and then IDEX will come up with our PAC system. It'll just take a second. And then our loading screen, and then we have his radiographs. Here you can view all of his past ones. So we have, earliest from June 2016. You can scroll down here and it says we did abdomen. And another one we did abdomen. We did his chest. And then the barium study, and then barium study. So that is one way to look him up. Another way is we can go directly to this little paw print up here. It says IDEX PACS Home. You click on it, and of course he will pop up. So let me just get rid of him real quick. I love it. This is where patients that we've done today. And if you need to do a patient that you've seen before, you can go up here and type in the patient's name. So let's say we'll do my other animal, which is Persephone. We'll do search, and then there's 3 Persephones that come up, but you can definitely tell the fact that they've had x-rays with us recently is because their x-rays will show up. So we're going to double click on there, and her abdomen is right there. And again, you have, you know, from August 15th, September, and all the above. So those are the 2 ways that we are able to find x-rays. And then the way we request it is how we have our new system. So you will right click on the patient's site. We will do find image request. Try again. Oh, it's actually off right now. I apologize. But you would typically do image request, and a screen will pop up saying what type of x-ray you need to do and who's the doctor in charge. So in just a second, I will transfer to the other computer. And also with our radiographs is we have our x-ray table, which is right there, and that system is strictly connected to our IDEX and our computer management system. So as soon as that cassette goes into this machine, it will pop up on this computer, which is the IDEX form of the radiographs, and it's connected to the patient's chart at all times. So when we hit complete, if we take in the x-rays, it will shoot the patient back saying we are done, and it will go over to this screen that is all connected to, and it will show the proper radiograph story. Alright, so this is our other computer in our radiograph study. So we have this one that we're just on, and this one. This one is stating that these are the patients that are currently waiting for x-rays. We have this system where it says these are all the ones completed, all in the last 3 days. So we have my dog there again. And then what is currently waiting. So it's going to say, hey, what is requesting right now. It's going to take a second just so it doesn't, make sure it doesn't misses anything. Alright, so I'm going to go and click on, we'll do another employee. So we will hit this green button that says execute. So we'll go to her screen, and this is how we're going to label and decide what x-rays we're going to be doing. So this screen pops up. We can do anything from skull to thorax, spine, abdomen, pelvis, forelimbs, high limbs, study groups, contrasts, exotics, and others. So we can definitely, you know, add in, let's go with thorax. So we have lateral and VD. So when we go over there, these 2 will pop up. So this is the proper labeling for when we insert our cassettes in. It'll go into this this reader right here, and whichever one is highlighted, that will be the one that is going to save under as. So when we look at it from a further stance in the future, we can tell that yes, this was the right lateral versus the VD. Kind of how it showed up on this one as well. Yes, it did say just abdomen, but when you click on it, it will go to the main form of which is which. And all patients will have their names on it, our birthday, and it will have all these options on it. So when we go to one that's already been done, so let's go to my dog again. What shows up is his name, his ID number, and the owner name, when we took it, and what time, to our marker, and just to indicate, yes, that this abdomen radiograph was taken on his right side. So his right side is laying down on the table, and that's where the x-ray beam is shooting from. And then we have like the VD. We flip it over so it's like you're actually truly looking at it. So this is the left side, and this is the right. So that's how we definitely properly label. Again, there is his name and information, birth date, and the date we took it at and time. So that's how we properly label in-store radiograph. All right, in this video, I'm going to be demonstrating how to handwrite a radiograph. Okay, so we have our written log right here. So we have our date, our patient name, the anatomy, radiograph views, our KVB, MAS, our MA, which is our settings and our exposure, and if we're sedated or awake. So I did my dog on Monday, which was, if I go to the date, which was November 6th. His name is Charlie, and we did abdomen, which we did a barium study. So radiograph views. I know we did plenty of views, but the two views are the exact same. So we did a right lateral and VD. And so for a KVP, I'm going to refer to our chart that we have. And so I remember him because it was very, 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 very easy. He was 79 and 6 because his number was 13. So we will write 79 and 6, and then our MA, which is 300. And then our last one, we were sedated or awake, and we were awake. So that is how we do our logs. So if we did another one, which was Harry, which I did do again on the 6th. His name was Harry. We did hips. We did did a right lateral and a VD. And then him, he was a bigger boy, so we're going to go to extremities. He was 79 and 10 and 300. So we write 79, 10, 300, and he was sedated. So that's how you write your logs. Thank you. Poor Beanie. Shake. 13, 15. Good boy. Yeah. Oh, 13, 15. You're gonna have a fun day. Alright, now you can stop it. You're recording, right? Good boy, Bean.
Does it matter if his head is sideways?
Yes, or his head, no, but his chest is. His chest is all the way over there. Okay, you're good. I know, baby. Can you rotate him this way? This chest. Okay, a little less. Good boy.
Yeah, you want a little
sip a sip. Yeah, no.
It's because I have a snooty corgi. I know, baby. Good boy.
Stop.
Yeah, it's fine. Alright, stop. Focus on just his bottom half. I just flipped them.
Pulse is still good.
Yep. Here we go. Alrighty, so we got my patient's hip x-rays. He was a 9-month-old Labrador Retriever who just went under for neuter, so you can kind of see this as well. Here are his hips that we got in. We got his femurs and everything. And then on the VD, how you saw in the video, I pulled his legs out, I extended them, and then I rotated my hands inward to get the femurs straight as possible so you get this image. So far these look great. There's no signs of any hip dysplasia or anything wrong so far. So the patient did really well, and later I'll kind of go over a few of the procedure tips. I just couldn't at the time just because he was under anesthesia for a little bit, but he did great and these look awesome. Thank you.